نحمد ونصلي على رسوله الكريم أما بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. I'm very grateful and excited to present this functional recovery of schizophrenia in this schizophrenia update conference, which was organized by a wonderful gem of a person, Dr. Ali Mufti, in collaboration with the chairperson, Professor Sayeed who is himself an expert on various aspects of schizophrenia. And I was very happy to see very big names of who are working in schizophrenia, like Dr. Mohammed Ayub, who is working on genetics of schizophrenia in Pakistan. So I know that this is not a very good option of broadcasting a recorded presentation, and I'm myself not feeling very good about it. But unfortunately, because there were some Wi-Fi issues, so maybe I would be able to join and love to respond to your question, maybe not. So I won't waste much of your time. It will be a very brief presentation. The reason why I started thinking about the functional recovery of schizophrenia was because one of my patients about a year ago asked me a question which made me confused and absolutely wordless, speechless. And it was very confusing. So I thought that I should think about it and then started working on it. And we formulated a group, and now we are working on this concept of functional recovery of schizophrenia. The question with that young female, who's 26-year-old now, from an affluent class, was very simple. She said to me that I am stable on 300 milligrams of clozapine. But doctor, do you think when I got sick at the age of 18, my friends, my cousins, my family members who have progressed in their lives, they have achieved something professionally, or my cousins or my friends are married, having children, do you think I would be able to achieve that? And I had no response to it. I tried to respond to her, but I know that inside I was not very comfortable. Qala Rasulullah sallallahu alaihi wasallam is that none of you is a real believer until he loves for his brother what he loves for himself. And this, if I generalize, is for all humanity, all the people that we are seeing and trying to treat. So if I want to be happy, prosperous, and having a good mental health, I want the same for my patients as well. And unfortunately, it gives me more complicated responses to what I was thinking. गालिब का एक शेर है, मेहरबान होके बुला लो मुझे चाहो जिस वक्त, मैं गया वक्त नहीं हूं कि फिर आ भी न सकूं. And unfortunately, that gaya vakt in the life of schizophrenia, patient suffering from schizophrenia, is very complicated and very miserable. And we unfortunately are not able to think and even expect what is going in their lives. As a psychiatrist, if we try to understand these dynamics, things will be much easier for them to understand as well. And these concepts probably would be much more acceptable and palatable to all of us. This functional recovery of schizophrenia means that the people who are unfortunately suffering from it not only have remission from the symptoms, which is part of the diagnostic criteria, ICD-11 and DSM-5, but what about the other areas which are not part of the diagnostic classification system, like everyday living skills, like productive activities, independence, cognitive impairments, side effect of the medications, comorbidities, substance abuse? Now, when we talk about schizophrenia as a whole, lots of things are not covered with the diagnostic criteria or classification system. Should we don't never think about them? And if not, why? So this is the reason why I believe that this concept of functional recovery of schizophrenia is important. And now the current focus is not on just the remission. The focus is on recovery. And recovery means, again, not only one domain, all domains, and one of the domain is functional recovery. And it's difficult concept, and it is evolving. with each passing day. There are lots of problems associated with this concept. When we say functional recovery of schizophrenia, there are problems in consensus of the definitions. So when I was in school, my friends in my class, some of them are businessmen. They just completed their graduation and they started the business. Some of them are professionals, some of them are technocrats, and one or two of them are actually politicians as well. How can we define accomplishment? And how can we define accomplishment in normal, healthy population and in actually the people who are suffering from schizophrenia? It is more tricky, more problematic, and more complex. So there are no clear standards. They're just merely the absence of disease never means recovery. And there are so many value judgments and motivations, motivational factors involved as well. That further adding to it is a more complex situation of East versus West. So what is happening in West is not happening in the East, back in Pakistan, and the recovery process is further complicated. So we have to focus on so many areas like reduce risks for relapse, adherence to medication treatment, social relationship, readmissions and emergency visits, etc., etc. So the definition is complicated. The involvement of a psychiatrist for complete recovery is complicated, and we never, unfortunately, focus on these areas. So achievement of some level of success across some combination of functional domains is important in schizophrenia, and we should go through that. So we propose that functional remission is a separate domain of functioning from clinical remission, and subjective response, and argue that the process of recovery include all these domains. So we propose that as soon as we start seeing a patient suffering from schizophrenia according to the classification system and start the treatment, the medical treatment, we should start evaluating the other processes in his or her life as well. The psychological, the social, and other factors as well, and start working on them to achieve complete functional recovery so that we'll be able to tell our patient, well, yes, hopefully now that you are stable on 300 milligram of clozapine, you will be able to achieve what other people have achieved in life of your caliber and your status. This is tricky. It's complicated. Probably it's a dreamful state, but we have to still work on it. गालिब का शेर जाते जाते दफन करने से पहले मेरा दिल निकाल लेना गालिब, कहीं खाक में ना मिल जाएं मेरे दिल में रहने वाले. You all live in my heart, and I am always blessed to have so many wonderful people around me. And I am happy if I'll be able to come online to respond to all of your questions related to it. But in real life situation, the outcomes are not only the remission, it is beyond that. This is functional recovery of schizophrenia. Thank you very much for listening to me. Hope to see you soon. Allah Hafiz.